Yes, ladies and gentlemen, we are all welcome to this edition of the Cameroon Town Hall for Healthcare Professionals. If you are joining for the first time, this is where we meet every fortnight to discuss on important health issues that concern our country, Cameroon. We have had the opportunity to have members of the town hall who have attended the town hall, but who are not Cameroonians. So we continue to grow our community, and we are glad to have all of you here today. We hopefully are going to have a very exciting session today, as we have a very interesting speaker today and guest. Today I'll be co-moderating with Dr. Brian Tegomo. Hello, Brian.
Yeah, hi Elvis, and it's good to see you and welcome back. I think we missed you, not seen you for a very long time, and yeah, really thrilled to see you all, and greetings to Mono as well. I really looking forward to this discussion as well, and welcoming Dr. Yauba again for coming to the town hall. His insight has been super helpful. I think he has provided a lot of contributions to building this in enormous ways that I think we can't even begin to thank him enough. So I think the subject that he's touching on today, Elvis, is so crucial. I think as we rethink about public health for the future, we have to think about the multiple facets, engaging multiple stakeholders in discussion, whether these are the private sector or the public sector, non-governmental organizations or different countries. I think those are really crucial conversations that we need to have in order to galvanize the public health system that we do have in Cameroon. So I'm really looking forward to this discussion. I hope we will learn a lot. We'll have the opportunity to discuss and interact and engage in questions and answers. So over to you, Elvis.
Thank you very much, Brian. And I agree with you. In the past, each time we take a topic and we want to discuss it, we always realize that there are some other social determinants of health that will always impact the topic that we are discussing about. Be it emergency health, where we are going to talk about the nature of the road network and transporting patients to for urgent care. When we want to talk about malnutrition, we talk about agriculture. If we want to talk about issues of orthopedics, we think about insecurity and all the fractures and that are taking place in the Northwest and Southwest region, gunshot wounds, emergency care. So everything is related. And so at the level of the town hall, we thought that we should introduce a series of conversation that will bring in actors from outside of the healthcare space to come and really have a conversation with us on how their actions and activity impact healthcare. And in order to launch this series of the social determinants of health, we thought that the person to set to set the pace for this session will be Dr. Yauba Saidu, who is our speaker today and guest, because he has been on the ground in Cameroon working as country director for Clinton Health Access Initiative. They all interact with government and they all interact with the private sector. They all interact with all the different stakeholders. And I think that as an expert, he will be able to set a very good pace for us to start this series of conversations. So it's really going to be an interesting session. But before we get to start the session, let's get a word of welcome from our chair, Dr. Munoken.
Well, Elvis, thank you very much. And it's always a pleasure joining all the moderators in the town hall. And I'm really very thrilled each time I'm here. And your sacrifices cannot really be measured. And really coming to our topic today, stakeholders and how they influence health. Just the other day, I was involved in discussing in a little tumor board, and I got to hear how much help the Clinton Foundation health initiative is giving to our cancer care patients in Cameroon, and how much they're trying. As they told me a lot of good things, I was so thrilled that I almost wanted to convert this discussion to that, but I think that's not where we are today. But it tells me a lot of how Yauba is influencing and with the Clinton Foundation, they're influencing healthcare in Cameroon at different levels. I got this from Bingo, how you guys are really trying to get them access to oncology medications and essential drugs that are out there, and actually building a system where they could have sustainable care for cancer patients. So that's just the tip of the iceberg. I've always known what you guys do in the realm of HIV and how it has really led to the dramatic decrease in HIV among adults, and also where we are lacking in child and mother-to-child transmission. These are things that we're doing. So I'm really thrilled for us to have a conversation about other partners who are involved in healthcare and how we can actually participate and influence healthcare in the right way, Elvis. So over to you. And really, this is going to be a series of wonderful discussion, and I'm happy that no other person than Dr. Yauba Saidu is going to do this. So I'm always happy having him in the town hall. His perceptions and perspectives are very intriguing. You're muted, Elvis.
Yeah, you are right, Dr. Muno. The Clinton Health Access Initiative actually is doing a lot back home. If I remember very well, they have helped the government to actually institute a very adequate oxygen supply system for most of the hospitals in Cameroon, with much effort still being done to build really huge oxygen plants in the country. And their objective is that in the next few years, there will be no hospital that will have any shortage of oxygen in Cameroon. And not to talk about the work they have done in expanding and improving on our cold chain management system in Cameroon for vaccines. And especially this was done during the COVID-19, where they donated a lot of refrigerators to the government and health services. So we can keep talking about their work in Cameroon as much as possible, but I think that all this brings together the experience that he has in the different sectors as far as our healthcare system is concerned. Before we get to Dr. Yauba, let's just get some voices of our fervent participants in the town hall. We have Dr. Theodore, and now Dr. Theodore, I know you always have an economic lens when it comes to healthcare. What's your thought about the topic for today?
Thanks very much, Elvis. I think it's going to be an interesting topic, and I would like to hear what Dr. Yauba has to say, and most likely his experience firsthand in Cameroon. Thank you.
Thank you so much. Thank you. It's always a pleasure to have you. And we have Sonia and Difon. Hi, Sonia. Welcome to the town hall.
Hello, thank you so much.
We are glad to have you. What's your take on the topic for today?
I just saw the invitation. I'm an incoming medical student, so I'm just honestly just here to learn and listen to what you all have to say.
It's always a pleasure to have medical students and all those who are interested in the town hall. Keep coming. You'll make a lot of connections in the town hall. You have a lot of mentors and you have a lot of interesting areas you can start focusing on as you pursue your career in medicine. So welcome to the town hall. And we have Aqua Bong. Hello, Aqua. Welcome to the town hall. Aqua, if you are mute, you cannot mute and say hello to the town hall. If not, let's get George Ngok. Hello, George. Welcome.
Yeah, thank you.
It's a pleasure to have you. What's your take on the topic for today?
Well, I would say there's one area that's a big challenge in I'm studying in Cameroon, so I'll really be interested in knowing other perspectives from other people in this our area, since I work a lot with kids with cancer. So I really want to know what is going on in other areas. Thank you very much.
Thank you, George. There's nothing as interesting as eating and listening to the town hall. So what a nice way to spend your weekend. Bon appetit, and it's a pleasure to have you at the town hall. Ladies and gentlemen, if you are joining us, this is the Cameroon Town Hall for Healthcare Professionals. I'm moderating the session with Dr. Tegomo Brian, and we are going to be talking about the other social determinants of healthcare in Cameroon. We want to look at just how we can stop focusing only on the Ministry of Health and focus on the other sectors that affect the healthcare. Our speaker is Dr. Yauba Saidu, who needs no introduction because he is a fervent member of the Cameroon Town Hall. This is not his first time presenting in the town hall, but just for you to know, Dr. Yauba is the country director of the Clinton Health Access Initiative in Cameroon. He is a medical doctor and also a clinical research professional and public health expert, also with so many other professional back in which we decided to just keep it cool for today. We'll hand over the floor to Dr. Yauba to do his presentation. Thereafter, we're going to have Brian take over for the rest of the session to moderate all the conversation. So over to you, Dr. Yauba.
Thank you very much, Elvis, and it's a pleasure once more to be here. And it's really always exciting to be in this platform to get the perspective of different people and so on. So as Elvis and Mono said, I think it will be important to start examining other variables that directly or indirectly have an impact on the health status of the population. And I know many of these things, but the challenge is that, or the limitation of this presentation is that I haven't done like extensive research to compile some sort of a compelling presentation with very tangible data. But the idea here is really to kickstart the discussion. So we know that within this forum or within the sphere of public health, there are other factors that are very important when it comes to public health programming. Because if you don't think about them, you will definitely not get the expected outcome. And these factors are actually referred to as the determinants of health. So here, I think, I don't know whether, are you able to see my screen?
Still loading, maybe. Yes.
Are you able to see? Are you able to see the
Yes,
screen?
we are able to see it.
Okay, so I just decided to change the title a little bit. As I earlier said, the presentation is really based on a number of slides that I picked from left to right to put. And the idea here is really not to present like core data on the impact of the various determinants on health. But I just wanted to emphasize that there is really an intrinsic link between health and development, whether we like it or not. And because of that, there is a need for the government to purposefully target all the determinants of health in their development agenda. So we'll just want to begin this presentation. Let me see. I actually paid a special tribute to Dr. Manauda Malashi, who has been at the helm of the Ministry of Public Health for, I think, close to 5 years now. And really within this period of time, his accomplishment in the health space has really been remarkable. So what if you see on the right, on the right where this mouse is pointing, you actually see that there has been a tremendous growth in the number of health facilities in Cameroon. I think they have been some sort of about 20% increase. But again, when we look at the slide, we tend to see that most of these facilities are concentrated in the so-called big cities, Yaoundé, Bafoussam, Douala, and perhaps the regional capitals of each of these of the regions. And this also poses a problem of access as well as equity. And it really aligns very well with what Elvis was saying about the placement of a health facility. In short, the relationship between health outcome and the placement of health facility and where the patient resides. So if you have bad road networks, the patients will not be able to access these health facilities. They will not be able to access these health facilities to get the care that they need. And at the same time, if you have very bad road networks, the bad road networks will also affect the availability of basic health inputs in the different health facilities. So a lot of progress has been made to create facilities. And in many instances, most of these facilities have been state-of-the-art facilities. As you can see down here, the regional hospital center, I think currently we have about 8 regional hospital centers with state-of-the-art art equipment. And these centers are found in all of the regional capitals except Yaoundé and Douala that has a number of tertiary hospitals. And again, these facilities are equipped with state-of-the-art equipment, new generation equipment, including CT scan machine, X-ray machine, and all the other things, all other state-of-the-art equipment that you could think of, including respirators and so on. But the challenge with this setup is that despite all of this effort, this colossal investment, the investment may not actually lead to an overall improvement in health outcomes if other important determinants of health are not targeted and addressed. So we have spoken about one, which is the poor road network. I think this is a picture to your left where you could see how pitiful or how sorrowful the road network is. And when we have roads like this, they actually impede access to health facilities. So population cannot readily access health facilities on time. And you can think about what can actually happen when the patient has an emergency. And I'll give you an example. We typically see this type of challenges in basically all parts of the country, the forest region, and also the north. But the problem seems to be most prominent in the northern regions, where patients will have to cover hundreds of kilometers to access a health facility. And that may be one of the reasons that explain a very high proportion of home deliveries in those regions. Up to about 40 to 60% of babies are actually born in homes in the 3 northern regions. And at the same time, these sort of bad road networks, they disrupt the supply chain. So by disrupting the supply chain, they affect the availability of basic health inputs, including syringes, needles, medications, and so on. And by extension, it indirectly affects the quality of care that is provided at the health facility. Then another important factor that is frequently overlooked is the link between hygiene, sanitation, or potable water with a number of health outcomes, particularly the spread of waterborne diseases. So there are also important considerations like overcrowding in urban slums that kind of act as fertile grounds for the propagation of respiratory diseases and so on. But unfortunately, we have not seen a lot of traction in these areas to make them better so that they can actually directly or indirectly improve the health of the inhabitants. And then another important factor is really poverty, which to an extent will stem from the lack of decent employment. And we all know the relationship between these factors and good health. So the next slide actually kind of indicates that health is really a prerequisite for economic development and prosperity. So it impacts every aspect of the society, whether we like it or not, beginning from the primary industry, agriculture. A population that is sick cannot farm. And if they are unable to farm, that inability will reduce the quantity of food that is available in the market, and that can have some adverse consequences. Hunger is just one of them, malnutrition, but it can also contribute to insecurity or some sort of uprising. So hunger, which directly results from a sick population, their inability to grow food crops that will meet the demand of the population can really be a problematic factor when it comes to health. Another important determinant is disease outbreak, which can actually bring down the economy. We saw that with COVID-19, which has actually caused a global drop in various economic indicators across a different country, primarily because of a number of factors: lockdowns, disruption of global supply chain, hesitancy, fake news, and so on and so forth. So at the same time, when a nation is grappling with an unhealthy population, the one major thing becomes very obvious, and this is an increase government spending to battle the disease and outbreak. And we have actually seen that in terms of COVID. We have seen that in terms of Ebola during the West African epidemic. And we are beginning to see this with the rising burden of non-communicable diseases and injuries. So government spending is actually increasing because of the increasing prevalence of diseases. And at the same time, the increasing burden of disease is also indirectly affecting government's productivity. So there may be some correlation. I don't have the data that can actually show the impact of disease on GDP, and these are things that are known. And in that case, the government will not be able to generate the resources it will need to appropriately run its economy. And the next important factor is that disease can actually reduce the active workforce and then can affect the ability to learn. We have seen that with HIV. And many of us, if you remember, in the late 90s and 2000, we could actually see the dramatic impact that HIV had on the workforce, on basically all the different aspects of society, including the military, schools where teachers were lost their life from the disease, the military personnel lost their lives from the disease, and we had like entire families or generations or even societies wiped out by the disease. So in that way, when such a situation happens, the underlying consequence or the immediate consequence is that the nation will lack the people to actually drive its economic engine. And the other important factor that I put on this slide, it's the impact of poor health on the ability of people or children to learn in school. So it is well established children who suffer from malnutrition, be it simple things like micronutrient deficiencies, they have that high tendency of not able to understand what they are learning. And so dropouts in schools will be very high, which will have an impact on society. And the list can continue. The list can continue. So here, we all know that in 2015, almost 200 world leaders from different nations assembled in New York to ratify what they call the Sustainable Development Goals, which are like a succession to the Millennium Development Goals. And here you could actually see that 4 of the Sustainable Development Goals are directly linked to health, but all the other 13 are indirectly linked to health. So if we really want to improve health in different nations, or if leaders want to really improve the health of their populations, they really need to act on all the 17 Sustainable Development Goals. But the sad thing is that when we look at the progress that many nations have made, we tend to see that progress is really off target for many of the goals. The goals related to hunger, the goal related to poverty, which actually means that industries are not being created, people are not being employed, so they are poor. So there is really limited or minimal progress that is being made towards that end. And when we look at the goal related to zero hunger, we also see that it is red, which actually indicates that minimal progress is being made to ensure that people have the food that will keep them away from hunger. And it is the same thing with health. We have a lot of emerging and re-emerging diseases, and at the same time, we are kind of experiencing some sort of epidemiological transition in Cameroon and also in many African countries, which is characterized by the rising burden of many non-communicable diseases and injuries. And then we have the goal on education, which is still, although many people think it is on track, changes have not been made, but there is still a lot of problems, particularly when we think about progression from primary schools to secondary school to high school, university, and also to postgraduate education. So one of the interesting thing about this goal is that it essentially targets primary education. But what we know when we look at the different determinants of health, we see that the health status of a family directly correlates with the level of parental education, particularly the mother. So the more educated the mother is, the better off the family is. So a mother who has like secondary or tertiary education is most likely to feed his or her infants, and this mother is most likely to get his children vaccinated, is most likely to get his children sleep under mosquito bed nets, and is also most likely to embrace family planning compared to a mother with fewer years of education or no education at all. And then another important thing is gender equality, which I don't want to dwell on, but I want to talk about clean water and sanitation. It's actually a problem. If you look at the ratio, in short, the proportion of Cameroonians who actually have access to potable water, I think the proportion is really, really low. And then if you look at the percentage of open defecation, I think there are some there are some sources that estimate that almost 40% of Cameroonians do not have access to decent toilets. So percentage of open defecation is really, really high. And these are all important public health problems, which actually go beyond the frontiers of the Ministry of Public Health. And then we have issues like affordable and clean energy. This is actually catastrophic. We cannot actually measure the impact of energy, particularly electricity on health. I think we did a study that actually monitored the quality of electricity in different health facilities and how that actually affects the availability of vaccines and also commodities that are temperature sensitive like oxytocin at the facility level. And then you could see a lot of problems. The first thing is that most of the health facilities and also the communities in Cameroon are not covered by the national grid. So they lack electricity. And by extension, facilities that are located in those locations also lack electricity. So which means that parents or mothers may not be able to deliver safely in the night, care cannot be provided safely in the night, and also these facilities will have issues storing temperature sensitive commodities. And the list can go on. And when you look at all of these things, all of these goals, you tend to realize that they do not actually depend on or they do not actually fall within the remit of the Ministry of Public Health. So it extends far beyond the remit of the Ministry of Public Health. And that is one of the underlying reasons why the different stakeholders, the different ministries must also pay attention or must also start working purposefully or intentionally towards realizing these goals, because they either directly or indirectly affect the productivity of the ministry. This slide, I have a number of indicators which you could see. Access to water about 60% nationwide. But if you want to look at the spread, in short, the regional variation, you tend to see that there are some communities that basically do not have water. And this, particularly in the north, extreme north, and Adamawa, there are communities that children and mothers will have to trek for about 12 hours to get to a water point in order to fetch potable water, which is actually problematic. And we cannot underestimate the impact of water on health. We all know that about 70%, 60 to 70% of the body is made up of water. So we cannot underestimate that. And then the issue of sanitation, we talked about that. Just about 40% of the population has access to basic sanitation services. And this includes something like toilets and so on. So about 60% do not have. And the worrying thing is that you tend to see this type of problems, this lack of access to proper sanitation services, even in big cities like slums, new settlements, and so on and so forth. And it's an area where the appropriate ministry that is in charge is not giving sufficient attention. When we look at other economic factors, poverty, it's true that the poverty level is high, but here I've just limited to the proportion of people who live under 1.9 US dollar a day. That is about 1,000 francs. It's almost 20%. And then if we go up to the proportion of people who live under $10, we should be approaching somewhere around 40% or so. And this is also a very big problem. And most of these things is actually tied to unemployment. Here we see that we have some figures that indicate that about 4% of the total labor force is unemployed, which may be an underestimation, but at the same time, it may actually be accurate in the sense that most of our population, over 50% of our population is young and not actively involved in the labor market. But underemployment is actually a problem. It can be, it has like a direct relationship between the income and the health status of the individual, as well as mental challenges for the individual. We have education and technology, and really we are not doing bad when it comes to literacy rate. But again, as I said, most of the indicators are tied towards primary education and so on. And then use of internet, I think in the developed world, basically, many people use internet, and but the use and penetration in our service is still problematic. And we cannot underestimate the importance of internet and other technology when it comes to improving health, because that is like, and the internet actually acts as a formidable source for information, particularly health information. We have nutrition, where a number of children are malnourished, almost 31% of children are malnourished. And at the opposite side of the spectrum, we also see that an increasing number of adults over the age of 30 are obese. So we have this sort of nutritional problem where on the one side, we face the problem of malnutrition in children, and the proportion is really, really significant. Almost about a third of children are malnourished. And then we have about 10% or 11% of the adult population of people above 30 who are obese. And these are actually linked to nutrition and also other factors like inactivity and so on and so forth. The healthcare system, we talked about it. On my first slide, I presented the spatial distribution of health facilities. But when we want to look at the facility to population ratio, we still see that we have a lot to do. So the current figures estimate that we have about 2.1 or 2.2 health facilities per 1,000 population, which is really, really far below the recommended WHO standard. Then at the same time, we have challenges where Cameroonians are unable to pay for health services or finance the we should finance the healthcare system, because up to date, about 60–70% of the health financing actually comes from the pocket. It's true that some progress has been made towards rolling out universal health coverage, but I still think that we still have a long way to go. And again, there is just no way that this figure can improve if the other social determinants or if the other determinants of health are not improved. Determinants that are related to industrialization, creation of jobs, increase earnings and incomes, and so on. So there's just no way. The last thing that I wanted to show here is actually related to the community and the social context, where we have a ratio of female to male, mean year of education. It shows some sort of disparity when it comes to males and also females. And this is essentially tied to some of the gender-related goals, where we see that males tend to have some sort of an advantage when it comes to education over females, which is problematic. And we tend to see that males also have some sort of an advantage when it comes to things like access to employment over females. So here, I just wanted to, like, in a brief context, just to summarize the different determinants of health that we know, and really just to highlight how each of these determinants can impact health. I think the first of these determinants, which is very important and that many of us are familiar with the clinicians and also the policymakers, are individual determinants. And these are the genetic makeup, the age, the sex. So genetic makeup can actually predispose people or certain people to certain conditions like sickle cell, like Crohn's disease, and so on and so forth. So that is something that is known, and that is something that we as healthcare professionals, we tend to invest a lot of time to address. Another important thing is, another important determinant is sex. So we know that there are certain diseases that are peculiar to certain sex. For instance, breast cancer or cervical cancer or prostate cancer and so on. And then we also know that there are certain diseases that have a particular predilection for age. Infants or children under 5 tend to suffer from more infectious diseases than youth, or they tend to suffer from malnutrition more than adults and so on. And at the other end of the spectrum, we tend to see that elderly people also have an increased likelihood of developing certain conditions compared to medium-aged people or children. So these are the things that we know, which are very evident and which we spend our time, like clinicians and maybe public health authorities or governments, to actually tackle. But when we focus only on that and then we forget about the others, it becomes very evident that we can only do that much. In short, the outcomes that we will see will not be synergistic or will not be amplified, because we have not addressed the other things that can actually guarantee that these outcomes should be attained. And one of them is really governance, policies, and interventions. So when we talk about governance and policies, this can actually be broad and could extend to things like employment that are being created due to good governance or good policies, creation of industries, provision of tax incentives, and so on. And then we also have things like working conditions, which is actually becoming an important factor, particularly nowadays, where people will have to work long hours, and there is really a direct correlation between working conditions and mental health. So now we are beginning to see an increased prevalence of mental health conditions. And then we have regulations. If we don't have good regulations, then we may be impacting health indirectly. If we don't have regulations that could permit the importation of medicinal products on time, that could regulate the practice of, that could regulate medical practice, or even regulate the importation of foodstuff, regulate the importation of foodstuff or other aspects, be it industrialization, hygiene and sanitation, and so on, we may not be able to achieve the health outcomes that we intend to achieve. Then we have the physical environment, water, sanitation, air pollution, and so on, which we all know have an important impact on health, as we previously described. And then we have healthy behaviors that we definitely will have to study with either a sociological lens or an anthropological lens to actually understand what some of the behaviors that can guarantee or can contribute to better health outcomes. So most of these things we know them, but unfortunately we do not target them. And then the last item, the last terminal that I have on this slide is the social environment, which can mean so many things, right? Like access to healthcare, where health facilities are placed, where communities are located, crime waves, insecurity, social norms, education, social capital, culture, gender, and so on. So all of these factors have a way that they impact the health outcomes that we want to achieve. So a good example is, in short, to illustrate this, I have this UNICEF conceptual framework on maternal and child nutrition, which actually shows the interplay of the different factors. So most often, we as clinicians will look at we'll focus our attention on the intermediate determinants. We'll talk about diet, we'll talk about care, and so on. But from a broader perspective, this framework actually categorizes the determinants into about 3 key pillars. We have like the causes, and the apparent causes, the underlying causes, and the basic causes. So when we look at when we really want to address that problem from a sustainable way, we actually will need to target the basic causes. And these basic causes would be linked not to things like diet or food, but will actually be linked to things like governance. What are the governance structures that we have in place that could promote good health? Governance arrangements with regards to agriculture that will ensure that people produce the food that we need, or that business people import the food items that are healthy for our population. The money that is available to pay for these services, be it from the government perspective or from the patient's perspective, the implication of the public and the private sectors, the actions that are being taken to enable children and women to have rights to nutrition. So these are really like some of the basic things that we need, or nations will need to focus on to ensure that maternal and child and children, mothers and children have better health outcomes. So this is just like an example. So I think there is that need to actually view all of those major conditions from this angle. What are the enabling determinants, what are the underlying determinants, and what are the immediate determinants? For us clinicians, we definitely focus on the immediate determinants, because we sit in our consultation rooms, we receive patients that have a complaint who are already sick. Some may be acutely ill, others may be they have the chronic conditions and so on. And all we do is to take the history, provide some request for some laboratory examination, and then prescribe some medications, and which is fine. So to a greater extent, most of the time, we actually succeed in solving the problem. But in the long run, we keep on seeing those type of problems in our society. You keep on receiving children with malnutrition, you keep on receiving people with hypertension, you keep on receiving people with injuries and so on. And we don't actually extrapolate the implication or the impact of all of these things on economic growth and prosperity. And that is why it becomes important to actually approach health from a holistic perspective. We know the outcome, we want a better outcome for our population, and we know the intermediate determinants, and at the same time we know the other factors, but these factors like the underlying determinants and the enabling environment, they are actually not totally dependent on the Ministry of Public Health. So we need to start figuring out how do we engage these other factors. Please, would just mind to give me 1 minute. Let me connect my computer because the battery is actually okay. I'm so sorry for this. So I'm back. So moving forward, I think there is high time that we actually expand our dialogue structure or framework to actually start really sensitizing the other stakeholders who are really, really important when it comes to promoting good health within our context. And beginning with the first, economic development is really, really important. So the economy will need to grow. If the country needs to generate, if the country wants to generate the income, it will need to pay for improved health outcome. So the economy will need to grow. What are some of the things that can be done from an economic or industrialization perspective to propel economic growth? The second important thing is scientific and technological advancement. So we are actually very good at uptaking maybe social media interventions, but not so good in taking on board other interventions that can improve health. So there is really that need to change that sort of mindset to really like steer the different stakeholders to be ready to embrace scientific and technological innovations for health. So there are just so many of them, like this platform is one of them. There's telemedicine, but there are also other interventions that are available in the market that our patients need them, but we do not have them in our setting. And these are related to the innovations in the area of diagnostics, medical equipment, drugs, and also vaccines, and also the enabling technological infrastructure to deliver good health services. The other important factor is the community factors. So community factors, sorry, here I don't actually here I actually wanted to mean to indicate climate change. So we need to start thinking about how to mitigate the impact of climate change on health, because it is becoming so evident. We have, particularly in areas that are directly affected by this climate change. So we tend to see an increase in the number of vector-borne diseases, particularly those vectors that thrive in a particular climate. We begin to see an increase in sea level that by extension is affecting hygiene and sanitation and contributing to diarrhea diseases in some communities, particularly those communities in coastal areas or those communities that are found in areas with large bodies of water. And then the next important thing is political stability. So whether we like it or not, there is a direct correlation between political stability and good health. This is important in ensuring that we achieve the long-term goals in health, but it is also important. It is also important in the sense that it will enable us to conserve our health infrastructure, to upgrade our health infrastructure, protect the patients, and ensure that people who need healthcare services go to the health facilities. We have seen a devastating impact on the health of populations in the Northwest and the Southwest, and also in areas that where the areas that suffered from the activities from Boko Haram in the northern part of the country. And the next important factor is emerging and re-emerging infectious diseases. So there is a need to actually put in place systems that will enable our healthcare system, not only our healthcare system, but the country at large to deal with potential health threats, be them emerging deadly infectious diseases and others. So here I have the long list of all the ministries of Cameroon. There are about 32 of them. And then I think it's important to start asking the question, who should do what and when? Because as we have said during the course of this lecture, the different health outcomes that we want do not actually depend solely or do not actually fall solely within the remit of the Ministry of Public Health. So there is the need for other ministerial departments to actually get involved to do their own part that will directly or indirectly improve the health status of their workers and the population at large. So if we look at the list of all the ministries in Cameroon, we could directly see the different roles and responsibilities that each and everyone will do that will have a direct impact on health. If we have like a good transport system, good transport policies, and so on, then we limit the number of road traffic accidents, which by extension would limit expenditures related to treating injuries, and at the same time will minimize, at the same time would optimize the productivity of that individual. So that is just like one example. We have ministries like Ministry of Water and Energy and Water Resources. What can they do to improve on the availability of stable and reliable energy in health facilities and also in communities, because we know that many economic activities depend solely on energy. So what can they do to improve the availability of energy, and by so doing, improve the health status or outcomes of the population? The same also applies to water. So what can they do to improve the availability of water in the country? Because even as we speak today, water is really like access to potable water, not even potable water, access to any type of water is problematic in most of the major cities. And if that happens, if that is happening in most of the major cities, then you could start thinking about what should be happening in rural areas. So there is that need to start thinking about sensitizing the different stakeholders to start acting in a rational and purposeful way so that we could get the improved health outcomes, with the understanding that we need a healthy population to be able to drive economic growth and prosperity in the country. And most of these things actually will begin from the policymakers and the people who are in charge of making decisions for certain things that they may not be aware that have a direct correlation with health. So I think this is like my last slide that I had. But again, I just want to re-emphasize that there are a lot of data sets on all of these things, indicators that we could look at, establish a baseline. But the intention of this objective of this presentation is really to see whether I can stimulate the dialogue, whether we can start thinking of expanding the platform to actually bring in other people that have like the experience or the expertise on the meaningful actions that we could take to address the key determinants of health, as we have seen in some of the slides. So with this, I come to the end of my presentation, and I thank you for your kind attention, and the floor is open for questions.
Oh, thank you. Thank you very much. Brian, over to you.
No, thanks. I just wanted to thank Dr. Yauba for such an insightful presentation. Dr. Yauba, you shared a really compelling perspective on the link between the health and development, and particularly focusing on the importance of addressing social determinants of health within the government's development agenda. So I think he spent a lot of time emphasizing the critical role, which I think sometimes we don't think about, of the different social determinants of health and how those shape population well-being, and the need for purposeful action by the government to target some of those determinants of health, whether it's economic or it's social or it's environmental factors that have an influence on health outcomes. So I think that that was a really great perspective and a really valuable insight. And I think Dr. Yauba gave us an opportunity to reflect on how the government can integrate health consideration into its broader development strategies. So I really hope that we will have this opportunity to engage in a dynamic Q&A with Dr. Yauba and ask him all the thought-provoking questions, or maybe you can share your own experiences or your own perspectives on how we can have a very meaningful discussion on the importance of engaging stakeholders just beyond the Ministry of Health in addressing some of these social determinants of health in Cameroon. So before, if you all have questions, you can either use the, you can raise your hand through the chat, or you can put your questions in the chat and we'll try to address them. But before diving into those questions, I wanted to get a round with the moderator, Elvis and Mono. Maybe you might want to share some perspective of how you thought this presentation went and what were your thoughts.
Let me start before Mono takes it from me. It was really an insightful presentation, like you mentioned, Brian, and I always get caught by some statements that are, you know, when access to any type of water is problematic in a country, then we're in deep shit, because at least you can have access to dirty water. But when you have access to any type of water is problematic, that statement was very powerful, right? Which means that people really don't have access to water. And this means that it can be a root cause to know so many other problems, as we all know. So Yauba really painted a picture of so many areas of need. And I think at the end of this session, my hope is that we are going to ask one question, Brian, if you will permit, that we ask our audience one question: who will they want us to invite first to come here and talk? Let's call it which leader in terms of ministers, right? All these departments he mentioned are all headed by ministers. We'll ask the question in the hall: which minister should come first after this Yauba session? And we will do every effort to bring the person here so they can tell us how they can help, you know, bridge some of these gaps. So thank you very much, Dr. Yauba, for this presentation, and over.
Elvis, this presentation really made me to reflect about my younger days when I left med school. I think I always say this story. I was privileged to work first in the regional hospital in Bamenda. Then at a certain time, I was posted to Mancon. It's still in Bamenda, but I actually got to live the realities of Dr. Yauba's presentation. Who and what determines the quality of healthcare you're going to provide to people. So I was at Tinka. There was no accessibility to potable water in the whole community, so the hospital itself was affected. How could you even determine and carry out basic delivery of pregnant women without having clean water? You start to see how the determinants of health can affect people in itself. So there was no clean water in the hospital. There was no way to even sterilize equipment in the hospital. Carry out minor surgeries was a problem. Potable water in the community was a problem. So waterborne diseases was everywhere. You could actually study how the 4 delays in pregnancy, and you see exactly how it affects everyone. Seeking care, access to roads, network. I actually got to see that could be a problem even in the city. Reaching out for help even, and once you get there, how do you get the help that you want? No worker wanted to come and stay there. Most workers were posted there but never even came. I, for one, almost decided that I was going to give leave to the public service till I was in the city, while you are even in the hospital receiving adequate care, because all these things that are put in place, electricity that had to be there, run by some other ministry, not the Ministry of Health. Water run by some other ministry, not the Ministry of Health. There are many other social determinants that were just not there. I'm just taking that as an example, Elvis. So I think that by Dr. Yauba reflecting on, getting us to reflect on all the other stakeholders that can affect health, really brings me back to my real natural reality when I left school as a physician, and understanding that my influence in healthcare. I was just talking to some of my residents today that we need to be humble as physicians to understand that throughout the whole human evolution, what we have done as physicians in order to improve our longevity on earth or life expectancy is totally equal to nothing when compared to the other things. The first number one is hygiene and sanitation. After WHO did a whole analysis in the Millennium Development Goals, when the analysis were done, hygiene and sanitation was priority. Number two was the discovery of vaccination, which still has nothing to do with us who are in the inpatient hospital. Number three was discovery of the antibiotics. Number four was actually fighting against smoking cessation and other air pollution diseases. Then number five was everything we are doing in healthcare, including treating cancers, which I do for my lifetime, but we've never really shown that we're actually helping the population as a whole. So it's humbling that a lot of many other things that affect health have nothing to do with healthcare. And once you fix that, the health of the people improves. And the pure proof of it is that America has a worse life expectancy than many other poorer countries with better social determinants. So this is really one thing that if we get to discuss, we may actually improve healthcare better than what we're doing and really get to talk about things that would affect our people back home in Cameroon. So at least that's my reflection. And I think this is like a Pandora box we're opening, that we could have multiple people come here and talk to us, multiple ministers, multiple different engineers and different people. So that's my reflection. So.
Yeah, thanks a lot, Dr. Mono, and I completely agree with you.
Yeah, Brian, I can see Dr. Samuel unmuted himself. Maybe he also had something to say. I don't know.
Yeah, sure. I'll call on him, and thanks a lot, Dr. Mono, for sharing your perspective and your experiences as well. I think that was very deep and very useful as well. And thanks, Elvis, for requesting the town hall to select one of the ministers who can come and talk about this. I think when Dr. Yauba talked, we saw the immense intersections between the different ministries of health, ministries in Cameroon, and how they can potentially work together to have much lasting health benefits for our community. So I'm hoping that during this Q&A, we will have the opportunity to discuss about some of these challenges that Dr. Yauba highlighted, and hopefully we can identify some innovative solutions. We can also foster sustainable partnerships that can ensure that our development agenda incorporates these critical dimensions of health. I want us to, without much else to do, I would like to start off with the Q&A. I would like to invite Dr. Samuel. I think he posted in the chat to start us off with the Q&A. Yeah, you can start us off, Dr. Samuel. Over to you.
Thank you, Brian. Thank you very much. Dr. Yauba, thank you very much for, as Mono already put it, I just kept thinking, reflecting on everything. And I just want to add, for the sake of time, you can see I was actually in Cameroon. I was communicating with Mono, and I want to start with that the road, when I got to United States, one of the major things, if you take care of communication and transportation, is going to help other social determinants to fall in place. If you imagine, like, even if you have the medications or other health equipment and you are not able to take it to the hospitals, or somebody who is in need of help and in an emergency situation, the healthcare providers or the first responders will not even be able to reach those people. At the end of the day, I believe that's also very, very important. I want to share also, just based on what you were talking about, when I saw, just looking at garbage disposal. I was standing in Dove and I look around and I'm like, in the district area, do they even have areas where garbage can be taken to, or you just have to take care of yours? And then I look at the ceftriaxone virus. We have almost about 10 bags of those standing in our clinic, and we're just trying to figure out what are we going to do with it. So even the kind of incinerators they have for disposing of remains, when you just look at that in general, you can see the challenges that we have. And your presentation today just touched on all the social determinants. And I believe, just like the moderator was saying, if you were to ask me, if we look at our transportation and communication network, if we have just the basic, just from one of your slides, that's the exact kind of slide I have. I actually took multiple pictures because you have two 24-wheelers who are just stuck in the middle of the road, and many people traveling just have to, you are in the middle of nowhere and there's nothing you can do. So not to talk about clean water, talking about even the access to medications. I was discussing with Mono, we have 75 patients, sickle cell patients, and they have the money to buy, for example, just the hydroxyurea. Him and I, we've been talking about that, but there is the access to those vital medications that you need in emergency. There are many who are struggling to just have access to that. And I believe that governance, policies, working with our institutions, that will be very helpful. We are on the way looking at how the Ministry of Public Health and Ministry of External Relations working on a memorandum of understanding because we look at now, what are the basic things we can do now as we continue to move forward? Because many will ask, what do you actually have? What is going to help change my current condition right now? And I believe that this town hall and having you with the foundation, I will basically tell you those are the challenges many are facing, and your foundation is really doing a wonderful work. And I want to commend you for what you guys are doing. And thank you for the excellent presentation.
Yeah, thanks. Thanks, Samuel. I don't know if Dr. Yauba wanted to make any remarks on that, but thanks a lot for starting us off and sharing your experience from your recent travel to Cameroon. I think you highlighted some of the issues that we do face, the issues around the road network, and certainly how those have an impact as well. And so thanks a lot for sharing your perspective on that. I also wanted to recognize the regional delegate of the Southwest region in Cameroon, and it's someone whose perspective I would love to hear as well in terms of what the regional delegation of public health is some of the things and challenges that they face in addressing social determinants of health in the Southwest region of Cameroon as well. So definitely would love to get there as well. But Dr. Yauba, I really wanted to hear from you. What are some of the practical ways that you think the government can sort of incorporate social determinants of health into their development agenda, and also in the same manner engage multiple stakeholders in addressing some of these issues, so we can work collectively or in some sort of a synergistic approach to address some of the challenges that you highlighted through your presentation?
I think the government has already done a lot. So they have what they call national development strategy, SND plan. That actually is a reflection or distillation of the sustainable development goals. So they pick the sustainable development goals, and then they develop the national document on really how to implement what the government plans to do.
I think he might have had an internet glitch. Okay.
Oh, can you hear me?
Yes, we can hear you now.
Yeah. So they have this document that they call the national strategy, 2020, 2030 that has most of these elements. But the problem there is usually the intent of the document itself, because we really need to know how, we really need to understand how all of these global policies are being formulated and so on. So we have these sort of researchers or these sort of think tanks who actually determine what will be good for the world. So they prepare some sort of draft Millennium Development Goals, which they will later on transform to Sustainable Development Goals, and then invite the head of state of different countries and say, here we have 17 Sustainable Development Goals. If we think that if you implement all of these goals, we are going to have like a better world. So the intent is really to leave no one behind. We have to ensure that people have access to water, people have access to energy, people have access to healthcare, universal health coverage, and so on and so forth. And then the head of state will ratify these Sustainable Development Goals. And then they'll come back to their respective countries and then try to develop some sort of an operational plan or a national plan on how to implement this. They will do the plan, but the challenge will be that there will be some sort of a misalignment between the plan and the resources that are being allocated to implement the plan. And that is usually where the problem lies. So because when you do an evaluation, you realize that many countries are actually off track when it comes to the implementation of the Sustainable Development Goals. Many sub-Saharan African countries did not even achieve 4 or 5 Millennium Development Goals, not to talk of the Sustainable Development Goals. And the simple reason is that the planning is usually not done from it's usually not some sort of a need-based planning. So what does our population need? What does the community need? And then we move from there, we develop plans to address the needs of the communities. All right. So now I think they have this decentralization agenda where they are kind of transferring power to local councils so that to enable them better handle the development aspects of their municipalities. But one of the greatest challenge that I already foresee, is really the capacity of the people managing the councils to deliver. So that is one. Because of lack of capacity, most of the resources will be diverted. And the second important thing is the resources to actually implement the plans that will be developed by the council. So where would the resources come from? So the only thing that can actually assure that we have sufficient resources is if we purposefully implement interventions that will actually lead to economic growth, like creating more jobs, creating more opportunities. People should have more income and so on. So if we don't really target economic growth, if the economy does not grow, then it will become very difficult for the government to have the resources to actually finance investment in the country. So it's some sort of a difficult question, but believe me, if you ask many of the politicians, they will give you a convincing answer that things are actually on track. But when we come 15 years down the line to measure the progress, we realize that most of the indicators have not been hit. So for me, what I think we can do as maybe healthcare professionals or also healthcare professionals living in the diaspora, I think we can start using the method actually the methodology that people in the United States use to formulate health policies, right? Formulate the health policies and then get the parliament to endow the policies. And from there, if those things are endowed, then there's high likelihood of budget being allocated for those interventions to be implemented. So we know how things like the Obamacare came about, how the Biden moonshot program came about, and other important and transformational public health things that we have seen. Even an intervention or a policy like PEPFAR we know how it came about. It's not George Bush who decided that I should solve HIV problems in Africa. An expert somewhere decided to saw that as an opportunity and decided to create the plan, which actually went through the lower house and then the upper house, and then finally got ratified by the president. So today, George Bush is actually being accredited as someone who started PEPFAR and someone who started the President's Malaria Initiative. And these are initiatives that have had tremendous impact on the health of the population of many, many developing countries, low-income countries. And I think we can also do the same. Let's start by documenting some of these things, have them published, and then see how we can leverage that to influence policy. And the good thing here is that we tend to have some sort of very good relationships to some key stakeholders within the government, and we can use similar routes to influence that, to influence a bill to be passed at the level of the National Assembly. And once it is passed, we know that is an indication that the head of state is going to ratify or endorse a policy. So I think we can start thinking about using those sort of approaches. We have the data, we document, we publish, we develop, we transform those the published work into policy brief, and then we engage the necessary stakeholders in country and make sure that the bill goes to parliament. So for me, that is like the pathway that I see, and I think that is something that if we do, we may be able to influence a lot of things in country.
Yeah, thank you, Dr. Yauba. And I really love that you gave the example of PMI, and I thought that was a really great example of a successful program. I'd like to call on Fodop Samuel. Samuel.
Okay.
Yeah, if you can
hello.
just introduce yourself so we know who you are, and then you can ask your question. That'll be helpful.
Yes, I'll do that. So I am Fodop Samuel, an aspiring medical doctor studying at the Catholic University of Cameroon. And I used to beautifully evening to all the professors on this call, all the medical doctors and every other healthcare worker. And beautiful evening in particular to Professor Elroy Weligi. So my question goes this. I wish to start by thanking Dr. Yauba for this very insightful presentation. I was able to learn a lot. During this presentation, or during your presentation, Doctor, you spoke a lot about getting all the stakeholders involved. My question is, do you consider medical students as one of the stakeholders? Because I believe most of the policies which are adopted today will eventually be implemented by the future healthcare workers who are healthcare students today. So do you consider healthcare students, medical students, and all the other healthcare students to be important stakeholders? If yes, what are their responsibilities? Thank you.
That is a very nice question. And certainly medical students should be constitute an important stakeholder in this endeavor. And for me, I think one of their responsibilities is really to do the research and the documentation and get the information published that we could now leverage to transform into policy brief. So I think one of the things that medical students in Cameroon don't do is that they don't publish. I remember the time I published my first article. I think that was sometime in 2011 or so. So in the same journal that I published that article, I think there were a number of articles from third-year medical students in Britain. All right. So for me, it has taken me like 7 years to go through medical school, like 2 years to do like a postgraduate professional master's before coming to publish an article on the topic I researched on. And at that time, a third-year medical student in Britain has already published an article that is kind of influencing policy. So I think you medical students, you have a lot to do, particularly in the area of doing the research, doing the publications, and so that at least when we want to sit and formulate policies, we could actually like make use of the research that we have done. We can leverage the publications that you guys have put together as evidence for the evidence guiding or driving this policy. So that is just like one of the ways I see how you guys can become involved in some of these things. And at the same time, you guys can also do what civil society is doing, right? The role of civil society is to raise, I don't want to call it big noise, but civil society has an important role. So the are the guys who will actually kind of communicate a problem to the government, right? Because many of us, we know these things, but we don't communicate. But the civil societies, when they assemble from their agenda, like try to like organize themselves and communicate the problem to the government, then it's more likely that the government listens to the problem than if it is coming to one individual. And I think students have that opportunity compared to professionals like myself or other people who are very busy doing who are very busy on their rat race, doing their 9-to-5 job.
Thank you so much, Doctor, for that very insightful answer. My next question was about advocacy, and you just gave an answer to that. Thank you so much, Doctor. And you spoke about medical students getting involved in research. We are not really taught research in medical school until we get to our final year. So learning research may be a little bit more challenging for us. Maybe some useful connections could be of great help.
Yeah, you have to organize yourself and tell your university that we need to be trained on research right from the first day of medical school, because we understand the value of research. We want to use it as a tool to influence policy. We want to use it as a tool to actually grow our career and so on. So it actually still comes back on, and the honors actually comes back on you. You have to do something at their level to get the change that you need. Because obviously in today's world, there is just no way you can find your way without having the necessary research skills. Be it to get the information you need for your medical school, or even to learn things on how to like convince your girlfriend to like you, or simple things like how to save money or make money, or understand how the banking system works, or even understanding how the public system the public system or the health sector works. So those are things you will never be taught in school, but if you have the research skills, you can be able to like organize yourself and apply those skills to learn those fundamental things that will help shape your career.
Merci beaucoup. Dr. Theodore Gacho.
Thank you very much, Dr. Yauba. I think I enjoyed your presentation, and I think it's really important that we hear it from somebody who is actually in the field. What my take home from your presentation is that healthcare is an ecosystem. And like every ecosystem, you have various factors that actually contribute to make that system work well. And I think you clearly elucidated what some of those things that we need. One of my understanding, or something I've observed in the Cameroon system or society, is that on paper, we have lots of beautiful policies. Now, the problem comes when we have to execute. And your presentation clearly states it, that when we develop policies, usually there's a gap between the policy and actually the funding to develop the policy. Do you think that as a nation, if we go back and look at those things and we try to develop policies that we can actually fund and take little steps, we might make a difference?
Absolutely, Theodore. I think you're absolutely right. I think the major problem we face is really that of implementation, right? We have very good policies. In short, the basic fact is that we don't actually even develop those things. Those things are developed by experts. experts working for the UN, for WHO, and so on and so forth. And what we do, what our own national experts do is to a greater extent, and I'm really sorry to do this, to say this, is to a greater extent is a copy and paste, like what has the Senegalese done? Let's look at their plan, and then we adopt it to our context. Do find and replace. Anywhere you see Senegal, replace with Cameroon, and so on. And then you have a plan, then they gather people on the room, and then have that validated, and here we have our strategic plan. So the next question is, here you have the strategic plan. How do you go about getting the resources to implement the plan? The money will definitely need to come from somewhere. And really, it is really sad to see that most of the projects that are being implemented in Cameroon are actually kind of driven by donors. Like the World Bank will say, you have to do this, you will give you a loan, do it, and then like tie the state, the neck of the state, and the state will have to like pay them with exorbitant interest for a long period of time. And we also see that with a lot of developed bilateral agencies, the French government, the Chinese government, the German government, and so on. So all of those things, they don't actually kind of help the nation. So at the end, it makes the implementation to be targeted. We have interventions that do not really respond to the needs of the population or the nation, right? But at the same time, we are indebted. We have debts that we have to pay, right? So I think there is really that need of really shifting that mindset. And for me, I think the only way we can do that is really to develop the human resource, like people who can think, do the situational analysis, identify the bottlenecks, build their own strategy, figure out how to mobilize the necessary resources, and then implement. Right? For me, I think that that is like really one of the most sustainable ways we can do. We can approach. And then the second thing, which I think is really important, that we must do is to figure out how do we grow our economy. How do we grow our economy? Because there are a lot of benefits that come with economic growth. When the economy is growing, everybody's benefiting. We create more jobs, income level increases, the state gets more money from taxation, and so can fund other social projects and so on. So how do we really grow our economy? With the understanding that humans, a healthy workforce, is like the bedrock for economic growth. So we must ensure that the workforce, the citizens are healthy, and that they can drive economic growth. And then the second thing is figuring out how do we grow our economy. And honestly, I don't have an answer. I think that kind of question can be best answered by developmental economists or pure economists. But we must think, we must articulate, we must communicate. Economic growth is important for good health, and good health is necessary to propel economic growth. So we must communicate. I think at our own level, we just need to figure out how to communicate and sensitize people.
Yeah, thanks a lot, Dr. Theodore, for asking such an insightful question. Dr. Mono.
Yeah, Brian, thank you very much. So my question really is to Yauba, with his experience through working with the government, what do you think is going to take us to be able to fund our own projects with our own priorities put in place, generated by our own people, where we were going to be able to know these are our projects, this is what we want to fund for healthcare, and this is what we want to prioritize, and not depend and beg for funds from people who are going to give us their own objectives of how we should live our life. How do we get ourselves and become independent from financial influence? I just want to see you've interacted with your position, you've interacted for a long time. I've known you since when I was in med school, and I know you've had experience to actually interact with the government. What is it going to take us? And I know it doesn't really depend totally on the Ministry of of health in itself. It depends on the parliament and everyone to have that kind of mindset. What do you think? Is it this kind of discussions? Then my second question goes with, what is it going to take all our ministries to communicate? The reason I'm asking you this question, and to be able to prioritize, and when we're running a budget, to be able to see into consideration that when we're building a health center, the ministry of, let's say, which is in charge of electricity, I can't even forget which one is, it's going to be ready to put electricity in that hospital, in that community. The Ministry of Water is going to be able to make sure we have water there. Roads are going to be taken to that area where we're creating a healthcare center. There was a healthcare center that was created in Bamenda, upstation. Behind upstation, there was no road to go there for years. And the place, actually, Old Town, I don't know if you know that place. I lived in Old Town, I was just watching them. They created a health center where if a pregnant woman wanted to go and deliver there, she needed to move inside the bushes uphill, and that was the plot that was given by the governor at the time to the delegate to build a health center in Old Town. So it tells you really, as you say, I'm really trying to look at this problem and see, and how is it going to take us in Cameroon? What is it going to take us to have this whole ministries don't work in silo, but communicate and actually try to help each other to improve healthcare and determinants of health? My last question is about cholera. You know, it is said that in a country where you may want to call yourself a developing country, an emerging economy, cholera is actually an indicator of poverty. It's an indicator that you're still very poor and cannot manage your basic things in life. That's the different basic things that you're supposed to be able to take care of. How are we as a nation going to use this information today in order to advocate that we can really start by not having these outbreaks and disgracing ourselves as a country, Cameroon? So these are just three little reflections. Let me put it this way. I know they are difficult, but I want to know your take on them.
No, Bruno, I think you sounded as if these questions are little and easy, but honestly, I don't think I have an answer. And I really don't think I'm like the appropriate person to attempt to even to respond to this question. So I think most of the times I do have like a very interesting tactic. So if you ask me a difficult question, I look for someone who is more experienced to answer the question. And me, I'm really very good at answering simple questions. So I don't know whether anyone in the forum has some thoughts or some thoughts around the questions that Bono has asked, because they are way above my pay grade.
Let me attempt. Let me attempt the first question. The first question, I've always said this, that he who pays the piper calls the tune, right? It's a standard saying that holds true in most sectors. He who pays the piper calls the tune. The question has been, how do we finance our own project? By the time we are able to finance our own programs with our own funding, then we can call the tune to what we want to finance. But when we depend on Global Fund to fund all the malaria programs and HIV program, when we depend on PEPFAR for antiretroviral drug funding and all those things, they have the right to determine how we design our programs in those areas that they fund. The next thing is, how do we become, how do we get to that point where we can fund our own program? The first thing is, it's a macroeconomic discussion, because our governments like borrowing. And when they borrow at the backdrop of what? What's their collateral? Our natural resources. I heard the president of the African Development Bank the other day saying, discouraging African countries from taking loans backed by natural resources, because natural resources backed loans are the ones that impoverish us the more. That's why we keep talking about potentials. We have resources, we have potentials, but we can't make use of them, because sometimes a lot of these resources are already serving as collateral for some of the big loans we take and mismanage them. So I think we have a lot of resources, natural resources and potentials that if we concentrate on how to exploit them, transform them, and add value to them, then we can actually generate a lot of money locally that can fund certain programs. We look at the taxation system. Taxing without participation is almost like theft. If you tax somebody to pay a tax, that person should be able to see the impact on which that tax is creating on their lives, be it at council level. And sometimes when we look at these things at a very big level, we fail to look at the opportunity even at the most basic level of the council. When you go to the market to sell your cassava and you pay tax to the council, the question is, what am I expecting from my mayor? If the mayor can take the tax from all those who participate in the market days to sell this crop and there is this tax collected, if the mayor can use that tax to provide potable water, that is when we are using local resources to give access to potable water to our people. So it comes to a point where we have to go down to how we generate funds, be it from taxes, be it from natural resources, and how we manage those funds. And when I was an Obama scholar, I remember there was a Nigerian Obama scholar who was my colleague, whose role is in his country, his nonprofit is, what they do is they take public budget, simplify it, make their citizens to understand it so they can hold their leaders accountable. One of the things that we don't know a lot is that our citizens just don't even know what the budget is for their constituency. They don't know how it is defined. They don't even know who is managing it and if it's even being managed well. But at the time, that's another important thing we need to know. We need to ask questions. We need to hold our leaders accountable. What this tax I'm paying, how's money being used? Why should I be paying taxes when we don't have medication in the health center? Those basic questions citizens can start asking, and then we can start generating local funds, even from community level, and do the basic things before allowing the big politicians to decide what they want to do with our natural resources. So it's a whole big question, but I can just give.
Yeah, Elvis, as you said, I know it was a tricky question, not for Yauba, but the most important thing, when I worked, I'll always go back to this. When I worked in a situation where I had no option, I told you I worked in Mancon, I had to, then the mayor of Bamenda too, try to hold him accountable to take care of a health facility that was in his jurisdiction, and had to go read the laws of what governs even at the level of the council and what their responsibilities were, and present that to him in order to see if he could be able to help in a situation where there was no water in the hospital. But I think also we should be able to get our civil society to a point where they can be strong advocates, even at the level of the parliament. Why should Cameroon's budget for healthcare still be less than 5% when we're expecting it to be 15%? Where is the rest of the budget going to? What things are we prioritizing back home? And what are the outcomes that we're seeing? So these are real advocacies that I think if we do that, if we can top up our budget to 15%, then we'll not depend on a lot of people who are supplementing our budgets, because we are actually running most of the programs. Cameroon is running almost at the level of 15%, but most of the money is coming from stakeholders, whom Yauba is one of them, so which is a nice thing. Yeah, so then maybe going back to the medical students question, which that's why I also asked the question about different ministries trying to collaborate. Because if the Ministry of Education understands what the goal for medical students is going to be in the future and the place for research, then the Ministry of Education needs to tailor its training now to suit the future and how the world has evolved and how these children need to be able to carry out research. And the Ministry of Research needs to accompany them in this process while they're getting training. So these are all, and then if you realize healthcare workers are trained by one ministry, employed by another ministry, and research is done with another ministry. And all these ministries have no way of even communicating within themselves and even understanding what the goals are for each person. So it becomes very, very difficult when we don't have that kind of link. And I think by discussing things like this and getting this ministry is able to talk. We may have people here who are able to really advocate at the level of the civil society and hold some of these people accountable and get them to collaborate. That would be good.
Okay. Brian, are we wrapping up?
Sorry, I realized I was muted. Sorry. Yeah, thanks. I think, Mano, you asked some very loaded questions. And these are things that we think a lot about, and practical, innovative solutions that we can really bring to the table. And those are realities. And it's not only Cameroon facing these challenges. These are realities in other African countries as well. They face the same similar challenges, and I really want to thank all those who asked questions today. I thought those were very thought-provoking reflections as well, and I think we can take those onwards as we continue this series on this particular series. So thanks. I will take a last round with the moderators. I don't know, Elvis, maybe some last thoughts on.
Yeah, no, just saying that it's been a very great session. I've learned from Yauba that we need to really have an sectorial approach to some of these determinants of health. Road networks are important, hygiene and sanitation are important, thinking about hunger and malnutrition, the fact that a sick population will also provide a weak workforce and will lead to hunger. So it's kind of a vicious cycle we need to break. It was also very interesting to know that the percentage of open defecation in Cameroon is still very high. I thought everybody had toilets already. Energy poverty is still an issue. Healthcare facility, most of them are not covered by electricity. 31.8% of our children are undernourished. I was in Burkina Faso last month, and there 4.9 million children are suffering from really serious malnutrition. Which means that it's an African issue we need to solve, but yet 40-something% of our populations are farmers. I don't know where the food goes to. 39.1% of the population has access to basic sanitation services, and 23.2% of the population use internet. But we saw that 4.5 million people are on Facebook, which represents more than 23% of internet users. So I don't know why more Facebook users but less internet users. But 85.1% of the population are literate. That's the good news. That's from ages 15 to 24 are all literate, which means that our country has done a lot of advances in promoting education and child scholarization. We also talk about the fact that facility to population ratio is 2.2. Which means 2.2 health facility per 10,000 people. That's still below the standard, put in place by WHO. So we have to do a lot of work. Yauba said that for us to do this, let's look at some of these key areas: economic development, scientific and technological advancement, community factors, political stability, and taking care of re-emerging infectious disease. And I think Yauba made a powerful conclusive statement that we need a healthy population in order to drive the economic growth of a nation. That's what I was able to capture.
That's really great. Thanks, Elvis. And I want to pass it on to the chair of the town hall, Dr. Mono, for his concluding remarks.
Well, yeah, no, that's fine, Brian. I just want to say this is a very important discussion, because I always look at the Sustainable Development Goals. Everything around it is related to health. The few I can remember, they say zero poverty. I don't know when we're going to ever get to zero poverty in Africa. There is just so much discrepancy between the very wealthy and the poor. So much, and it's getting worse every day. Even the issue of hunger. You could be very surprised in the middle of Yaoundé, you would see children who come in totally malnourished and are unable to have a square meal every single day. Good health and well-being facilities. There are facilities in Yaoundé that are extremely top of the art facilities. There are other ones in Mokolo that are just a room with a doctor with no stethoscope or a nurse with nothing and no toilet at all. They call them VIP toilets that we used to use that, but there you have, even in the hospital, you have to go use the bush in order to defecate. Quality of education is what the medical student said. What kind of education are we giving to our healthcare professionals who are going to take care of us in the future? I don't think the people know that they're going to take care of them. And once they come to those hospitals, they'll meet the same people that they were trying to train. So it's something to really reflect about. The thing about it, one of my professors said, I'm training you well today. He used to say it because tomorrow when I'm old, I don't want to come and see you and you kill me, because that's really what could happen. The issue of clean water, as Yauba said, we even lack water, and I can testify to that. In the Northwest region in Bamenda, where I am, we had to come as a community in the center of the town, from Frontier Street right up to my phone. There'll be no water for more than 10 years. That's telling you that there is really problems happening with healthcare in Cameroon. I'm not going to list all of those Millennium Sustainable Development Goals. I don't know all of them. There are some of them I actually hold very dear to me. About 2 years ago, I attended a meeting in the UN here. A friend just came around, called me, and took me there, and they were talking about these goals. My first question was, I asked those who were ambassadors, African ambassadors, because I was an African ambassador, how many of you were available and present when these goals were designed? And how many of you frankly and truthfully thought that your countries could achieve them? And why did you sign up to something that you knew purposefully that you were not going to achieve it? And could not even design goals that were going to be able to achieve them, because there is something about the human mind. When the human mind designs things that they cannot achieve it, they abandon it. And they don't even work towards it. And I don't think any of our countries believe that they could actually achieve any of these sustainable development goals. These were goals maybe meant for the US, Britain, and other places. They were not really designed for Africa. So Brian, I think this series of discussions, once we take one goal after the other, get experts to talk about it, try to get ministers to come to our platform. I don't know how Elvis is planning to do that, but he's a miracle man. But so I think he's going to use some of Yauba's influence for us to get some people here. I think Dr. Samuel too can help us. But if we can get the ministers here, that would be wonderful, Brian. And I'll be very, very happy to get some of them here, not for us to understand their plan as we did with the Minister of Public Health. I really want to appreciate the Minister of Public Health for his presence, his willingness to talk to his people, to be able to not even have all the solutions, but to be able to communicate. I think communication is the best and first part of every change that you want to do. Let people understand what the movement is all about. So thank you very much. And I just want to thank everyone who is here. And we're still going to have our regular parking lot for some few minutes. So Brian, thank you.
Yeah, thanks, Mana, for those concluding remarks. I just wanted to give Dr. Yauba just if he would like to make some concluding remarks as well. And thanks again.
Thank you very much, Brian. I think for me, we definitely will need to figure out how to get some concrete outputs from this town hall. I think a lot of information is being shared, and it's true that we do have that recorded in YouTube, but I think it will be helpful for us to start having some sort of a documentation or policy briefs or some sort of research that we could use to copy somewhere, and then subsequently leverage to guide or drive a policy change. And I think I did speak about this. I know we have a number of smart students here. Why don't some of them just decide to like write a paper on the determinants of health in Cameroon, or the needs to address the determinants of health in Cameroon, for Cameroon to have like a healthy population and move towards or make progress towards sustainable development goals. So we could use that evidence to actually lobby the Minister of Public Health, so he can also talk to his other colleagues and try to see how we can support him to actually advance his agenda during the National Budget Conference, which will actually eventually get to the Parliament for validation. So the goal here is really to make it clear that attending the different indicators, health indicators, depends solely, in short, to a greater extent, on the activities or interventions of other ministerial departments. So if those ministerial departments don't do their job, then it becomes very difficult for the Ministry of Health to hit certain indicators. And if they don't hit certain indicators, then they are actually like compromising on the health of their population, which will have an impact on economic growth, development, and also stability. So I think thinking around that line can actually help. I have studied a lot of policies that have actually emerged from researchers that have actually shaped clinical care or even funding within the U.S. Healthcare system. And I think it's actually time for us to also start thinking about how do we synthesize the information that we um, disseminate or discuss during this forum into something tangible that we could show to the Minister of maybe Public Health, the Minister of Mine, the Minister of Energy, and so on. And again, I think we do have a number of colleagues here that can help. If we produce a document in English, they can also produce it in French. And we write from our correspondence, send them to the Minister of Public Health, send them to the ambassador, and so on. And really not just be a forum where people just come and exchange ideas and then leave it there. The next time, take on different topics and so on. So I think we really need to be clear and strategic. What do we want to achieve? What needle, in short, what distance do we want to move the needle to? Right. And then like really like focus our attention there on that and get it done. So by the end of the year, if we could really use the information which they discussed during this forum to influence even one policy or two policies, that would be like a great achievement for the platform. So in that way, we start like impacting the society in a positive way. We can say that open defecation is a problem. Let's communicate this. And there are a number of opportunities that we can use. We can figure out how to mobilize funds and take part in the World Health Assembly, ask for site sessions to discuss some of these things, organize some sort of funding pledging conference and so on. So I think we really need to think about the next step. How do we move from talking, from academic discourse into concrete activities or actions that can impact public health? And I see so many pathways that we can take. So maybe we may want to reserve one of these sessions to think about that and just think about a strategy for the town hall, developing some sort of a strategy that we can implement.
Yeah, thanks a lot, Dr. Yauba. I did take notes of all the points that you made. I think those were really very salient points, and it's something that we have discussed here a lot about, and ways to make this very practical, very implementable in the field. Many of the ideas that are shared on this platform, they are really revolutionary. We are probably one of the few because I've tried to reach out to other African countries if they have this level of engagement, but it's not. But leveraging some of the knowledge and expertise that is available on this platform and how that can be used and galvanized to improve health in Cameroon, very practical steps. And I totally agree on the importance of drafting some policy directives at the end of each session that can be uploaded or kept somewhere, maybe on a website, or even made available to different ministers of health in Cameroon. I think definitely agree those would be very important. But I also wanted to invite Dr. Mono, maybe you might want to make some comments.
Yeah, thank you, Brian. I think Dr. Yauba made very important points about the way forward. And civil society is all of us. So we can be talking here, and it's good for us to also start taking action. And there is some good news, which I would always want to share in a time like this. There's time for good news, where through the town hall, which I think the moderators will send out an email just through the town hall, a lot of advocacy has been done through the town hall. And one of the ministers who was here at the town hall, the Minister of Public Health, who is a very dynamic person and wants change back home, made a promise to create a department where the diaspora could be able to function directly with his minister, with his ministry. And I think that has been actually accomplished. And the minister selected members to be part of that. Fortunately, we have 2 or 3 of them here. Dr. Theodore Gacho is one of the members who is going to be there and advocate for the diaspora. There is Dr. Samuel Jikita, who is going to be the rapporteur, one of the main rapporteurs there, and he's going to be. So these are concrete things that are happening. And I think by us having our voice in that ministry and being able to talk about the things that we care about for Cameroon as diasporans and what change we actually have, how to collaborate with those who are back home is going to be a positive thing. So I am just getting the cat out of the bag here, but I think we'll send an official email telling everyone about this. And please, Dr. Yauba, you're part of this whole team, right from the conception of this. I think we spoke about this whole thing. Moving forward, we are grateful for your support and always happy to have your insight about discussions and the way forward. And I think it's something the moderators will work around it, and we are always ready to work with medical students. I saw that our young medical student, Samuel, he's been very active today, and we are ready to work with medical students to get mentors. Don't be afraid to contact us for mentorship. Don't be afraid to contact other moderators. There are so many moderators here who are good researchers and they can teach you research. Brian sitting here is one. There is Dr. Jean-Claude. There is Elvis, who is doing a lot of research. And I have an MPH that I've kept under my pillow, though I do research probably. I do a lot of research in oncology, but not more like public health and policy. So it's a wonderful thing for us to really talk about how we can take this to another level, but be able to choose goals that we can actually be able to deliver, not be like our African countries where we're going to go advocate for goals that we're not going to, at the end of the day, achieve any of them. So I hope this is going to be a discussion that the moderators will take to heart. And we're also looking for a way for those who are logging into the town hall to see if we can create CME credits. I think that's one thing we're going to work by the end of the year, try to achieve it. Those who come in and they are interested in taking CME credits, they can actually go online and answer 1 or 2 questions, and we can always have an objective and a plan. That's all you need for CME. To get an objective, get plan, and then you get 1 or 2 multiple choice questions, and they can get some CME credits while they participate in this just spend precious 2 hours with us. So Brian, that was my little input. I don't know if Elvis and yourself have something to add, because as I've always said, though Brian and Elvis, they keep talking about cheer, this town hall belongs to the people of Cameroon. It belongs to those who are in Cameroon, those who are in the diaspora. You guys are all stakeholders of the town hall. And if you have anyone you think we can bring over, anyone you know that we don't know how to get them here, if you also know a minister and you know that you can bring him here with your connections, let us know. We're not going to hesitate even one bit. If you know every Cameroonian who is causing change and who can affect our healthcare system, tell us, contact us. We're going to provide the platform for that Cameroonian to be able to do change and tell us about how they can evoke change back home. And if you want us to introduce him to some of the ministers that we know, we're going to do that too. And through the town hall, we've really provided a space for diasporans. I think it's something that is ongoing, and I really want to thank all the moderators for the wonderful job they're doing. Thank you very much, Brian.
No, thanks a lot. I think that said, I will just close the town hall.
And please don't forget, we still have our parking lot session.